How to treat and cure reactive attachment disorder. Reactive attachment disorder is a rare but serious condition in which an infant or young child doesn't establish healthy attachments with parents or caregivers. Reactive attachment disorder may develop if the child's basic needs for comfort, affection and nurturing aren't met and loving, caring, stable attachments with others are not established. With treatment, children with reactive attachment disorder may develop more stable and healthy relationships with caregivers and others. Treatments for reactive attachment disorder include positive child and caregiver interactions, a stable, nurturing environment, psychological counseling, and parent or caregiver education. Symptoms. Reactive attachment disorder can start in infancy. There's little research on signs and symptoms of reactive attachment disorder beyond early childhood, and it remains uncertain whether it occurs in children older than 5 years. Signs and symptoms may include withdrawal, fear, sadness or irritability that is not readily explained, sad and listless appearance, not seeking comfort or showing no response when comfort is given, failure to smile, watching others closely but not engaging in social interaction, failing to ask for support or assistance, failure to reach out when picked up, no interest in playing peekaboo or other interactive games. Reactive attachment disorder is rare. Signs and symptoms can occur in children who don't have reactive attachment disorder or who have another disorder such as autism spectrum disorder. It's important to have your child evaluated by a psychiatrist who can tell whether such behaviors indicate a more serious problem. Causes. To feel safe and develop trust, infants and young children need a stable, caring environment. Their basic emotional and physical needs must be consistently met. For instance, when a baby cries, his or her need for a meal or a diaper change must be met with a shared emotional exchange that may include eye contact, smiling and caressing. Risk factors. The risk of developing reactive attachment disorder from serious social and emotional neglect or the lack of opportunity to develop stable attachments may increase in children who live in a children's home or other institution, frequently change foster homes or caregivers, have inexperienced parents, have prolonged separation from parents or other caregivers due to hospitalization, have a mother with postpartum depression, are part of an unusually large family, such that parental time is scarce or available unequally or rarely. Tests and diagnosis. A consistent pattern of emotionally withdrawn behavior toward caregivers, shown by rarely seeking or not responding to comfort when distressed. Persistent social and emotional problems that include minimal responsiveness to others, no positive response to interactions, or unexplained irritability, sadness or fearfulness during interactions with caregivers. Persistent lack of having emotional needs for comfort, stimulation and affection met by caregivers, or repeated changes of primary caregivers that limit opportunities to form stable attachments, or care in a setting that severely limits opportunities to form attachments. No diagnosis of autism spectrum disorder. Treatments. Treatment strategies include encouraging the child's development by being nurturing, responsive and caring. Providing consistent caregivers to encourage a stable attachment for the child. Providing a positive, stimulating and interactive environment for the child. Addressing the child's medical, safety and housing needs, as appropriate. Other services that may benefit the child and the family include individual and family psychological counseling. Education of parents and caregivers about the condition. Parenting skills classes. Controversial and coercive techniques. These techniques include any type of therapy that involves forcing or coercing a child in order to break down what is believed to be the child's resistance to attachments, an unproven theory of the cause of reactive attachment disorder. These controversial practices can be psychologically and physically damaging and have led to accidental deaths.